So that health psychologist might actually be doing a lot of education for that client and helping them and making sure that they understand what's happening when pain impacts them, and how through psychotherapy or therapy or counseling that they can actually help relieve some of those painful symptoms just by doing therapy. What is up, fam? Welcome back to the channel. My name is Phil Sarpong. This is Phil's Guide to PsyD. This channel is dedicated to all things clinical psychology, wellness, and graduate school. Today, I'm going to be talking about health psychology. Just a little bit of a recap. When I went through the first year of clinical psychology school, didn't have any practicum clinical rotation. Then my second year was my first clinical rotation or practicum site, and that was in a neuropsychology site where I did a lot of neuropsychology testing. Now, in my second rotation, I'm in my third year of my program, and so my second rotation is actually working at a hospital. Now, what's really cool about this is that it's a health psychology clinical rotation. So you can think of health psychology as basically the combination of psychology and medicine combined together. When we talked about neuropsychology is very much focused on the brain and how things that happen in the brain impact behavior, right? And so neuropsychologists are most likely going to work a lot really closely with neurologists. Health psychology, on the other hand, is basically this combination of what happens in your body, health-wise, physiology-wise, but also how the body, what happens in your body health, how that impacts your psychology. Health psychology is your body, the health of your body, and whether things like disease or addictions, how that impacts your psyche. Most health psychologists are going to work in hospitals, medical centers, academic medical centers, and so forth. So health psychology is going to be one of those things that I think is going to become way more popular as time goes on, especially because we're noticing how a lot of different medical conditions, things like diabetes, hypertension, smoking addiction, all of these different things impact people's health. So for example, if you have someone who is going through or thinking about bariatric surgery and that they want to lose a lot of weight, they want to go through this surgery is going to help them lose weight. There's a lot of different factors involved even before they get to the step of the surgery itself. So what's going to happen most of the time is that they're going to get paired with a psychologist who's going to make sure that from a mental health perspective that they're doing okay, whether they don't have any significant things like PTSD or trauma or anxiety or depression. It's really important that they take care of their mental health, because even as they go through the surgery and after the surgery, they could have some mental health complications. And so it's really important to have a therapist or a psychologist get in there even before they make the decision of the surgery to help them with any mental health concerns that may come up. What's also really important is that they talk to a dietitian and that they are paired with a dietitian. And so what's really cool is that a dietitian and a psychologist can work together. The dietitian might help the patient with their food and nutrition, and the psychologist might help the patient with their mental health, anxiety, depression, things that may come up. You also may have the physician that may look over their medication. This individual patient has a team that is surrounding them, that is helping them through each step of the way, either medically, physically, psychologically, nutrition, all of those things to make sure that they are going to be successful before, during, and after the surgery. So it takes a whole team to help someone in that individual perspective. And for the health psychologist, it's really important for them not to only understand the physiology and what medications that patient is taking, but also understand overall how it's impacting them, because that way they can help them with their psychology, their mental health, their emotional and psychological health as well. What I've found as a lot of health psychologists do is that a lot of health psychologists will actually do a lot of education for their patients. For example, in relation to chronic pain, a lot of medical physicians and doctors don't have quite the time to be really invested in their patients' well-being psychologically. And oftentimes, they may only have 5 minutes, 10 minutes, 15-minute appointments with patients because they have so many patients that they have to go through. So what ends up happening is that patients may have a ton of questions about their health-related concerns, and it may be difficult for them to reach a physician. But if they are paired with a psychologist who's also in communication and talks with the physician, that psychologist might be the one to actually educate that patient, especially during therapy. So therapy might look a little bit different in terms of just focusing on psychological health. Therapy with a health psychologist might actually look a lot like understanding what's going on in their body, how their pain is impacting their mood, diagnosing and different things like that in terms of pain, chronic pain conditions. So that health psychologist might actually be doing a lot of education for that client and helping them and making sure that they understand what's happening when pain impacts them, and how through psychotherapy or therapy or counseling that they can actually help relieve some of those painful symptoms just by doing therapy, right? And so again, that is a team effort, right? Because that patient might also be paired with a physical therapist and be going to physical therapy sessions while also seeing a psychologist on the side. For example, some of the things that I've been doing has been related to helping patients with tobacco cessation, helping patients that are struggling with sleep issues, insomnia, migraine issues, chronic pain. And then the other thing is exercise, right? A lot of times we're paired with health coaches to help clients get on a scheduled basis in terms of exercising consistently. So the wellness for the body, the mind, and the psyche is all kind of mixing together for the health psychologist to be able to help that client. So that's a little bit about what I'm doing in my third year, in my second practicum rotation, and looking forward to the following year where I'll be doing my last rotation. We'll see where I end up in my last rotation, but that's at least where I've gotten to so far. All right, so with that, if you haven't already, subscribe to the channel, like this video, and I will see you guys in the next video.